مساء الخير. نيابة عن الدكتور باسل كانتري مانجر الحكمة في العراق، وعن جميع زملائي موظفي شركة الحكمة، نرحب بكم اليوم وممتنين منكم وشاكرين فضلكم بقلوبنا ومشاعرنا، لأن دائما أنتم بالخط الأول اللي يحارب هذا الوباء، يدافع عنا وعن كل البشرية. أتقدم بالشكر والتقدير والاحترام لأولئك الذين يواصلون عملهم ليل نهار في جميع مواقع منازلة هذا الوباء. نوصيكم جميعا انه ديروا بالكم على نفسكم، ونوصي نفسنا وناسنا واحبائنا بالالتزام بالاجراءات والارشادات الضروريه للنجاه من خطر هذا الوباء حسب توجيهات وزاره الصحه، ومنها التباعد الاجتماعي والبقاء في المنزل، وتنفيذ الاجراءات الوقائيه الموصى بها من قبل الجهات المختصه مثل منظمه الصحه العالميه في جميع الاوقات. نحب أن نشارككم ونبلغكم أن عائلة الحكمة لن تتوقف أبدا عن العطاء، إن قابليتنا على التكيف مع التغيرات وتعاوننا وثباتنا على رأس عملنا وإنتاجيتنا أكثر أهمية الآن من أي وقت مضى، لضمان توفير جميع أنواع الأدوية للمرضى والأطباء على حد سواء، تركيزنا كفريق على الاستمرار أعمالنا، وأن نبقى على عهدنا المتوفر بتوفير صحة أفضل في متناول اليد كل يوم لمن هم بحاجة إليها. دكاترة الأعزاء، أنتم أبطالنا، وسلامتكم دائما وأبدا أولوياتنا، فالتحية لكم. ومن هاي الأدوية اللي احنا نقدمها هو الأموكلان. الأموكلان أموكسوكلاف من الحكمة هو الوحيد اللي موجود حاليا بالسوق العراقي اللي ابروف من الاف دي اي. تلاحظون هذا الاموكلان. الاموكلان اموكسوكلاف موجود بشكل جار. هاي الجار تحفظ لنا الاموكسوكلاف والاموكسوسيلين والجلوفلانيك اسيد بعيدا عن الرطوبه والهيوميديتي والهيت اللي راح يجونا هذا الفصل الجاي. لذلك احنا حطيناه بشكل علبه. هاي العلبه بها انتي هيوميديتي تحافظ لنا على كل الفارماسيوتيكال انجريدينت اللي موجوده به، على عكس بقيتها. اضافه الى هذا الشيء راح تشوفون حضراتكم انه الاموكلان هو البراند الوحيد اللي موجود بالعراق حاليا ابروفد من الاف دي اي والايميا. اف دي اي في امريكا والايميا في اوروبا، مثل ما تلاحظون بالخريطه المعروضه، موجود من امريكا، اوروبا الغربيه، كل منطقه المينيا والميدل ايست لحد اوزبكستان. وهاي بعض السيرتيفيكيتس اللي موجوده عن الاموكلان ابروفد باسمه بالاف دي اي، مثل ما تشوفون هاي الدوكيومنت. اضافه انه ابروفد باسمه باوروبا المهره، هاي مثل الاف دي اي في امريكا، اضافه الى شهاده الايزو. الحقيقه احنا يسعدنا اليوم ويشرفنا انه نقدم الدكتور بروفيسور دكتور حسين فيصل الحويزي، بروفيسور in College of Dentistry, University of Baghdad, Chairman of Scientific Committee of Iraqi Dental Association. نتمنى من الدكتور حسين يتفضل بإلقاء محاضرته. دكتور حسين من فضلك بس لو شغل الميكروفون، لانه حضرتك ما مشغل الميكروفون، حضرتك ميوت حاليا.
اوكي هسه؟ اوكي
اي اوكي هسه.
شكرا جزيلا.
بس دكتور قبل ما تبدي جنابكم بس احب اشير لكل الاتنديز انه اكو فوق بوكس بكيو اند اي شخص يريد يكتب سؤال خليه يكتبه هنا حتى نهايه المحاضره نقرا على دكتور حسين. شكرا جزيلا. نرجع نستمع دكتور حسين.
اوكي فشكرا جزيلا على اعطائي الفرصه بانه اني احكي عن التوبيك اللي هي مهمه جدا in endodontics. يعني we're going to talk about antibiotics in endodontics in general and then about the amoxicillins والاموكلان يعني in specific. طبعا من البدايه اني this is يعني فشي كلش مودست بسيط نقدمه الى زملائنا وزميلاتنا اطباء الاسنان اللي هسه هم بالمحك والخط الاول لمواجهه هذه المرض والجائحه كورونا. فنحن يعني اني يشرفني انه اكون يعني قد انه نسوي فد شيء ولو بسيط الى اخواننا واخواتهم واخواتنا بهذا الوقت الصعب، وبارك الله بهم واشكرهم جدا و please stay safe. The contents of the lecture it's going to be divided. First of all, we're going to talk about microbiology in endo so that you understand what are the things that the microbes that are present in endo that are threatening our work. Ampicillin in general, then amoclan, then uses in endodontics. This is very important, and clinical cases. I've got many clinical cases and I chose a couple so that I would show you when to use the antibiotics and when not to. First of all, microbiology. We all know that we've got around about 700 species of bacteria in the necrotic pulp. Odontogenic infections, really they are one of the most prevalent diseases in the body. They may be divided into periapical abscesses, 25%, as we can see here, pericoronitis 11%, and periodontal abscess 7%. These infections are mostly polymicrobial. You can see here we've got rods, we've got cocci, we've got all sorts of microorganisms. So this infection is not restricted to one type of microbe. That's why we need an antimicrobial agent that is it affects all these bacteria. So controlling the odontogenic infection is done by our debridement of the root canal, whether it is through the root canal or by drainage of the pus through incision, and or maybe we may need or may not antimicrobial therapy. But here, this is very important. We need to have signs of systemic spread, signs and symptoms of systemic spread of the infection, so that we use antimicrobial agent. We all know in the necrotic pulp here, as we go apically, we will have less oxygen, less nutrients, less number of bacteria, and the bacteria will be very difficult to remove. We've got many lateral canals in the region. But these areas will be harbored by what we call the obligatory anaerobes. They are very, very strict or very tough bacteria to kill. They need a strong intracanal medicament or antibiotic. We've got many types of pathogens in the oral cavity. We may have streptococci, corynebacterium, staph, prevotella, porphyromonas, Fusobacterium, and bacteroids. These are all present in the root canal. But what really troubles us a lot is that these bacteria, they don't stay by themselves. They make what we call a community. And this is called the biofilm. This is the biofilm, as you can see here, which is a community of polysaccharides harboring the bacteria, giving it food and giving it shelter. So we have to remove this in order to kill the bacteria. So we do that with the intracanal rotary instrument. Then we irrigate. And by irrigation, there is a possibility that some of the bacteria will go outside. So when it goes outside, now we're going to talk about infection that is in the soft tissue and the bone region. This is a close-up of the biofilm. You can see the community of the biofilm and the polysaccharide, and this gives it shelter and nutrients. We start now with ampicillins. What is ampicillin? Antibiotic dental prescriptions, they account to 7 to 11% of the body antibiotic prescriptions. Antibiotics should be active against both aerobic and anaerobic bacteria because we have got both in the root canal region. This is Alexander Fleming in 1929. He discovered the penicillin, and we can see that the spectrum of activity of the penicillin, it started with the primitive penicillins, which were, for example, G. This is narrow spectrum. Now, what do I mean by narrow? It kills less species of bacteria. They modified it into amoxicillins. They extended the spectrum whereby it kills more species. And now we have got the broad spectrum, which we call the amoxicillin and clavulinic acid. One of them is the amoclad. Here, as the American Academy of Endodontics stated, that nearly 100% of the bacterial species in the root canal in the odontogenic infection may be affected by this combination of antibiotics. Until now, the amoxicillins are the first line of antibiotics used in the US and Europe, as stated by the AAE. And the problem with the penicillin and the amoxicillin is that they are less effective now because there are bacteria that are called beta-lactamase producing bacteria. They affect the action of the amoxicillin and the penicillin. And these bacteria are so many. They are around about 74 to 88% of the bacteria around. So we have to think about this problem. It is a lot. So adding the clavulinate makes the amoxicillin more effective. And as we can see here, it's not just dental infections that are good for this combination. We may have infections of pneumonia, ear infections, bronchitis, urinary tract infection, skin, and of course dental infections. So we can use it in any other infection. Now we come to the amoclan. Now the amoclan, why this combination? The amoxicillin with the clavulinic acid, as I stated, it protects the amoxicillin from degradation. Therefore, it makes the amoxicillin active. And it broadens the spectrum of the antibiotic action. It kills more species of bacteria. Now, we may use the 625 milligram pill or the 375 one. But the maximum daily dose of the clavulanic acid should be no more than 250 milligrams. The action of this combination, it acts on the cell wall of the microbe, therefore killing it by destroying the cell wall. As we all know, the cell wall is the outer protection of the bacteria. So if you destroy it, you will introduce all the you'll make the bacteria vulnerable for any external stimulus or irritant. The advantages here, they are available in various dosage formulation. They cover gram-positive, negative, anaerobes, therefore broad spectrum. They are well tolerated, good compliance, and safer with fewer adverse effects. And this is very important. These are the formulations, the formula: amoxicillin trihydrate and clavulanic acid. Absorption is within 1 hour of oral administration, and this is very important. I want a drug that can be absorbed easily, and it is absorbed but not affected by the gastric acid secretions. The absorption here is not affected by food. We may take it with food. 70% of the amoclan is present free from any serum. This is important because I want it to bind to other structures like bacteria. And the combination does not really influence the absorption of either drug. Metabolism, 50 to 65% it gets metabolized by the kidney and by the gallbladder. And it kills gram-positive and gram-negative aerobes and anaerobes. It's a broad spectrum, and really this is what we want in endodontics and odontogenic infections. I don't want to give the patient many antibiotics to kill or to decrease one infection. I want this an antibiotic to be one that eradicates all or most of the causes of infection. Now, uses in endodontics. As we can see here with this video, our problem with bacteria starts when it enters the pulp and then it goes to the dentine quickly. If not treated, it goes to the pulp and quickly it penetrates to the periapical, to the root canal. After that, it enters to the periapical region. Now here, if I treat such a case, I can treat the case with intracanal medicaments. I don't need antibiotics. But if any spread of infection through the bone or surrounding teeth, here there will be some systemic problem. Therefore, I need antibiotic coverage. Now, in such cases, that means my infection inside the pulp and the pulp chamber and the pulp canal, like irreversible pulpitis, or even small systemic apical periodontitis, or a localized area of apical abscess. If I can do the good debridement, give a medicament, for example, calcium hydroxide, and minimum drainage, I can control or control the condition without any antibiotic coverage. But when this case spreads, the infection spreads, I will see that the patient has fever, malaise, lymphadenopathy, trismus, limitation in the movement or opening of the mandible, increased swelling, cellulitis, osteomyelitis, and persistent infection. Here, without any doubt, I need an antibiotic that is broad spectrum, that could stop my infection so that I can control the condition. And one of them is the amoxicillin plus clavulanic acid, which is one of them is the amoclad. The bacteria, when it enters to the bloodstream, for example, streptococci, they enter to the bloodstream with the red blood cells. In a normal person, these microbes will be killed after 10 minutes because we've got a good immune system. But in patients having rheumatoid or rheumatic fever or mitral valve prolapse, there is a possibility of infective endocarditis. That's why it's important when I've got a spread of infection in patients who are medically compromised patients, I need to give them a broad spectrum antibiotic. If this patient has a problem with immunity and the condition becomes a more serious and life-threatening bacterial invasion, you will see many bacteria in the bloodstream. We call it septicemia. It happens when the body defense is getting low and the infection is very overwhelming. Here we will see that there are severe signs and symptoms. Now these signs and symptoms, they will tell me that I really need antibiotics. In cases like this with a cellulitis, which is acute infection of the alveolar and loose connective tissue, as we can see here in this picture, there's a spread of infection in the loose connective tissue and the spaces. Here, endodontically, we call this condition a flare-up. Now, endodontically, this may happen after the first visit when the patient comes to us with a necrotic pulp and we only minimally open up the root canal and place intracanal medicament. If the bacteria is so strong and very virulent, the patient may come after 1 day with swelling, and this is what we call the flare-up. So if I am skeptical about this case, I may give a prophylactic antibiotic in such necrotic cases that they may need antibiotics. Otherwise, there is no need for antibiotics at that time. The AAE stated it clearly that the penicillin group is among is the first line of defense of antibiotics, like the penicillin VK, the amoxicillin, and the combination of amoxicillin with clavulanate. Why? Because it is broad spectrum. I don't need a lot of dosage. If I use 625 milligrams tablets, I use it 3 times daily. And it kills round about most of the bacteria. If I've got sensitivity, I may consider sensitivity to penicillin. I may consider other types of antibiotics. This is one of the cases of my cases I posted a couple of weeks ago. This patient came to me. I took an X-ray to him, and I saw that there's a huge lesion making 4 lower anterior teeth non-vital. I checked the vital signs of the patient. He didn't have any signs and symptoms of any spread of infection. The condition was very stable. I used calcium hydroxide for killing the bacteria inside the root canal, and as you can see here, after a couple of months, the lesion has receded. But sometimes, like this, a case of retreatment with a minimal lesion here, once we open up the root canal, here there may be very virulent bacteria. This condition needed antibiotics because there were signs and symptoms of spread. There was fistula in the area and the beginning of feverish or rise in temperature in the region. That's why I had to take or give an antibiotic, the Moclan or the combination of this drug. And as you can see here, I finished my endodontic treatment. So really, the size of the lesion really is not something that we have to put as the criteria. We have to look around the tooth. We see the condition, if it has any fistula, if it has any swelling in the region. All these things, they have to be considered. That's why we use a broad spectrum antibiotic as the amoxicillin plus clavulanic acid, Amoclan. Uses of antibiotics in endodontics, we've got local uses and we've got systemic. In the local uses, now we don't use antibiotics for pulp capping, for irrigation or intracanal medicaments, or even in the obturating materials. But in cases when I've got trauma or, for example, reimplantation of an avulsed tooth and I want to ensure that there is no infection in the region, certainly I need broad-spectrum antibiotic. In cases of regenerative endodontics, which is really now getting to be more popular, I need the triple antibiotic to be used. For the systemic uses here, I need signs, any sign of systemic spread or immunosuppressed patients or bacteremia, I have to give antibiotics to stop the infection. And thank you very much.